My name is Paul Caldwell at Tuckahoe Orthopedics and Orthopedic Research in Virginia, and I would like to share a case with you today that illustrates some of the advantages and versatility of MACI. I'll walk you through the diagnostic arthroscopy, assessment of the chondral lesions, the MACI harvest, as well as the implantation. Our patient's a 24-year-old fourth-year medical student. She enjoys recreational athletic activities, and her expectation and goals after the MACI procedure were to return to activities of daily living as well as recreational sports without pain or swelling. She has an 8-year history of right knee pain and swelling. She sustained a single patella dislocation playing high school soccer. She's not had any additional instability events since then. She currently has pain with stairs as well as deep knee bends. She experiences popping and clicking with daily activities. She still tries to exercise but is limited due to the swelling. She's tried physical therapy, anti-inflammatory medications, as well as bracing without relief. On physical examination, she does have some crepitation in the patellofemoral joint with ranging of the knee. She has a moderate effusion. She has mild quadriceps weakness. Otherwise, she has full range of motion of the knee and her knee is stable. Here you see a lateral and sunrise view of the right knee. You can make out a loose body within the patellofemoral joint. A magnified view of the same x-rays demonstrates the loose body more clearly, which is highlighted within a yellow circle. Here you see T2 weighted axial and sagittal MRI cuts of the right knee, demonstrating a full thickness chondral lesion of the lateral facet of the trochlea. A magnified view of the same MRI demonstrates the trochlea lesion measuring approximately 12 mm by 11 mm. The loose body is also highlighted in the notch. Let's move on to an arthroscopy of the knee. We will plan to perform a diagnostic arthroscopy to confirm the findings of the MRI as well as rule out additional pathology. We will remove the loose body, perform a chondroplasty of the patellofemoral joint, and evaluate the chondral lesion more accurately to determine if she is a candidate for MACI. Once this is accomplished, we'll harvest a cartilage biopsy in preparation for future open MACI implantation with a tibial tubercle osteotomy. Here you see an outside view of the arthroscopy of the knee, inserting the arthroscope into the lateral portal and viewing the patellofemoral joint. We first come down the front of the trochlea and into the notch. You can see that the ACL is intact and we move into the lateral compartment. You can visualize that the chondral surfaces of the lateral compartment are pristine and there's no evidence of a lateral meniscus tear. We move back to the notch and into the medial compartment. The medial compartment is without chondral lesions and the meniscus is intact. Once we establish that the remainder of the knee is normal, we turn our attention back to the patellofemoral joint. You notice right away that there's more chondromalacia on the undersurface of the patella than we could appreciate on the MRI. Once the patella is evaluated, we turn our attention to the lateral trochlea. Here you see the full thickness grade 4 cartilage lesion that was noted on the MRI. I prefer to use an arthroscopic ruler to document the size of the lesion, not only for insurance purposes, but also to demonstrate to the patient the need for additional surgery. As consistent with the literature, the lesion is often much larger than what was demonstrated on the preoperative MRI. I also think it's valuable to switch portals to evaluate the lesion from a different angle, as well as to measure in orthogonal planes to fully understand the size of the lesion. Once we've evaluated the chondral lesion as well as the corresponding surfaces, we turn our attention to the harvest. I prefer to harvest from the superior lateral aspect of the notch. Here you see a probe outlining the ACL as well as the lateral aspect of the notch. Also note that this patient has a very prominent sulcus terminalis, which is an excellent landmark for the transition from the lateral weight-bearing cartilage to the patellofemoral cartilage. I find the large open ring curette that comes in the MACI harvest set makes it very easy to harvest. A gouge may also be used in this regard as well. Although this part of the procedure may be taken lightly, it's very important to obtain an adequate harvest. I would recommend using the edge of the curette to penetrate the cartilage all the way down to the bone and then slowly working your way up the side of the notch, slightly pronating and supinating the hand while keeping constant pressure. If you're not careful, it's easy to slip and injure the adjacent cartilage. Once the biopsy is obtained, it's helpful to turn off the water on the scope to ensure that the biopsy does not turn into a loose body. Also, make sure you grab the biopsy by the end so that it easily slides through the soft tissues. Keep in mind that the biopsy pieces should be about the size of a tic tac to obtain an adequate harvest. Here you see the biopsy pieces as well as the loose body next to a ruler on the back table. The biopsy pieces are then placed into a harvest container to be shipped off to Vericel. Here we have a healthy, young, active, compliant patient with a low BMI and a full-thickness cartilage lesion with no bone involvement. She seems like an ideal candidate for MACI implantation. I did talk to her about MACI prior to her arthroscopy, but we had a more in-depth discussion once we knew she was a good candidate. We discussed our long-term goals, which were to eliminate her pain and swelling, as well as to slow the progression of the degeneration of her cartilage of her patellofemoral joint. We talked about the phases of rehabilitation and the journey back to sports. We also discussed performing a concomitant tibial tubercle osteotomy to unload the lesions and decrease the shear forces on the implanted cartilage. Let's jump ahead to the implantation. Here you can see the excellent exposure of the patellofemoral joint after the arthrotomy with the tibial tubercle osteotomy. You can easily identify the lesion on the lateral trochlea and appreciate that the lesion on the patella has certainly progressed since her initial arthroscopy. We elected to address both lesions at the time of surgery. Here you see highlights of the lesions after preparation as well as implantation. Our patient is currently focusing on rehabilitation. She's back to activities of daily living and progressing towards participation in sports. Although recovery after MACI is certainly different for every patient, the rehabilitation is very straightforward and user-friendly for the patient as well as the therapist. I always provide the patient with this easy-to-follow rehabilitation manual preoperatively. I have found that patients have less anxiety about surgery and recovery after reading this information. I also provide this more detailed rehabilitation manual to the treating physical therapist postoperatively, which reduces questions and gives the patient confidence in their therapist. This allows us to work as a team to understand our goals and the timeline to accomplish these goals. Initially, we focus on protecting the implanted cells, and our goals are to reestablish the range of motion and get back to activities of daily life. Once this is accomplished, we progress to building strength back into the extremity, and our final phase is sport-specific rehabilitation and return to prior athletic endeavors, which typically occurs between 6 and 9 months postoperatively. The MACI surgical technique has undergone significant advancements, making this procedure so much more straightforward and reproducible. The custom cutting guides for templating have simplified the preparation of the defect as well as improving accuracy. This has flattened the learning curve for surgeons and made it much easier to integrate into practice. This case illustrates some of the major advantages of MACI compared to other popular cartilage treatment options. Treatment of cartilage defects in the patellofemoral joint is very challenging due to the irregularity of the topography and the lack of consistency of the anatomy from patient to patient. MACI is particularly well suited for this specific cartilage defect as it gives the surgeon the ability to conform MACI to the patient's own anatomy. MACI has also stood the test of time for lesions of the femoral condyles with excellent long-term results. Thanks for your time, and I hope this case was educational.
Indication for use. MACI, autologous cultured chondrocytes on porcine collagen membrane, is an autologous cellularized scaffold product that is indicated for the repair of single or multiple symptomatic full-thickness cartilage defects of the adult knee with or without bone involvement. MACI is intended for autologous use and must only be administered to the patient for whom it was manufactured. The implantation of MACI is to be performed via an arthrotomy to the knee joint under sterile conditions. The amount of MACI administered is dependent upon the size, surface in centimeters squared, of the cartilage defect. The implantation membrane is trimmed by the treating surgeon to the size and shape of the defect to ensure the damaged area is completely covered and implanted cell side down. Limitations of use. Effectiveness of MACI in joints other than the knee has not been established. Safety and effectiveness of MACI in patients over the age of 55 years have not been established. Important safety information. MACI is contraindicated in patients with a known history of hypersensitivity to gentamicin, other aminoglycosides, or products of porcine or bovine origin. MACI is also contraindicated for patients with severe osteoarthritis of the knee, inflammatory arthritis, inflammatory joint disease, or uncorrected congenital blood coagulation disorders. MACI is also not indicated for use in patients who have undergone prior knee surgery in the past 6 months, excluding surgery to procure a biopsy or a concomitant procedure to prepare the knee for a MACI implant. MACI is contraindicated in patients who are unable to follow a physician-prescribed post-surgical rehabilitation program. The safety of MACI in patients with malignancy in the area of cartilage biopsy or implant is unknown. Expansion of present malignant or dysplastic cells during the culturing process or implantation is possible. Patients undergoing procedures associated with MACI are not routinely tested for transmissible infectious diseases. A cartilage biopsy and MACI implant may carry the risk of transmitting infectious diseases to healthcare providers handling the tissue. Universal precautions should be employed when handling the biopsy samples and the MACI product. Final sterility test results are not available at the time of shipping. In the case of positive sterility results, healthcare provider or providers will be contacted. To create a favourable environment for healing, concomitant pathologies that include meniscal pathology, cruciate ligament instability, and joint misalignment must be addressed prior to or concurrent with the implantation of MACI. Local treatment guidelines regarding the use of thromboprophylaxis and antibiotic prophylaxis around orthopedic surgery should be followed. Use in patients with local inflammations or active infections in the bone, joint, and surrounding soft tissue should be temporarily deferred until documented recovery. The MACI implant is not recommended during pregnancy. For implantations post-pregnancy, the safety of breastfeeding to infant has not been determined. Use of MACI in pediatric patients younger than 18 years of age or patients over 65 years of age has not been established. The most frequently occurring adverse reactions reported for MACI greater than 5% were arthralgia, tendinitis, back pain, joint swelling, and joint effusion. Serious adverse reactions reported for MACI were arthralgia, cartilage injury, meniscus injury, treatment failure, and osteoarthritis. For more information or to view full prescribing information, please go to maci.com.